All right, time to talk stretching, also known as mobility. One of the hardest things about osteoarthritis of the hip is as you have more and more grinding, you produce more inflammation. More inflammation equals more pain, obviously, which is what you're experiencing. It also equals more loss of range of motion. So a lot of your daily life skills, like reaching down to tie your shoe, start becoming more difficult because you don't have the same range through the joints as you did. So by starting a daily, hopefully daily, gentle stretching and flexibility program, you can help combat that and keep your muscles and your joints moving the way that you want them to move. All right, so with respect to these, you are looking to do them every day. And most importantly, you want to do them when your body is warm. So after you've gone for a walk, or after you've gone through your strength exercises, or after you've done a cardio workout, those are going to be your times to do them. If you get to the end of the day and you have not had an opportunity to do any kind of exercise, whether it's cardio or strength or take a walk, then take a hot shower or a hot bath. Anytime that you can increase the blood flow or increase the heat to the muscles, they're going to move better. Stretching cold muscles is not beneficial. So you want to make sure that you get the blood moving and get everything nice and warm before you start stretching. Okay, so we're going to start, all of these are going to be on the ground. You're looking to do 1 to 2 rounds through of 20 to 30 seconds per exercise. The first one that we're going to do is what we call a butterfly. So this exercise is geared directly toward opening the hip joint and working that mobility in the cup itself of where that ball is moving. So on our butterfly, the bottom of the feet are going to come together. We're going to pull the feet in towards your body to where you feel is comfortable. Some people, super flexible, can get the feet way in. Some people, they're pretty far away. So you're working with wherever your mobility is right now. The number one thing with stretching is that you don't stretch to painful. You're stretching for resistance. So as we go into stretches, you're looking for that point where you feel like your body's trying to resist you, but it's not painful. When you work into painful, you turn on your body's Golgi tendon, is one of the ones that does this inside your musculature. It stops you from moving forward. In fact, it fights even harder to move you back the other way. So it's not beneficial whatsoever to stretch to the point of pain. So on our butterfly hold, we're going to sit up nice and tall. We're going to reach forward and grab wherever on your legs you can comfortably grab. It may be your knees, it may be your feet, maybe your ankles, whatever works for you. You're going to take a deep breath in, and as you blow that air away, you're looking to pull your body forward while also pressing your knees down. So it's kind of a two-part move. I like to start with pressing my knees down, and then I pull forward. So I'm going to take a deep breath in, and as I let the air out, I'm going to press those knees down and pull my head forward. And when I feel that spot where my body is trying to push me back, I'm going to stop right there. And I'm going to hold for 20 to 30 seconds without moving. Most important that you keep the breathing going. If you're holding your breath, again, your body's going to start pushing you back the other way. So nice deep breaths. What you may notice as you hold for this 20 to 30 seconds is that your body starts to release a little bit, and you may be able to pull a little bit farther as the time goes. So at this point, I can reach my hands forward a little bit more and pull forward. So you're looking for 20 to 30 seconds. And then I'm going to release and sit back up and give everything a break for a second. Kind of shift things around. And then I'm going to repeat. So pressing those knees down, pulling my body forward, 20 to 30 seconds again right here. All right, now we're going to take it onto the back. So our next move here is one of our basic low back stretches. And always important about stretching the low back is if the low back is tight, you will start ending up with tightness in the glutes, hips, and hamstrings. So we want to make sure that we're keeping the backside really loose, especially as you increase your strength exercises like your chair squats and your leg lifts behind. So I'm going to roll back. Abs in tight, I'm going to press that low back into the ground. Grabbing the shins, I'm looking to tuck the body in So pull the head up. So what we're looking to do here is basically, if you think about the spine, we want to round the spine. So from the top all the way down into the bottom of the spine, we're looking to round it and tuck into a nice tight ball. Again, make sure you're breathing, looking for 20 to 30 seconds right here. As a variation on this one, you can do this one single leg as well. What I like about doing it single leg as well as double leg is that you're also, let me switch sides so you see better. You're also stretching this hip flexor, the front side of the hip, which is the one that when we talked about, we were doing the standing reverse kick. If this is super tight, you're gonna have a really hard time getting any range of motion, lifting that leg behind you. So tucking the leg in, I'm trying to press this leg down and then switch. So the opposite leg reaches out. Try to press the back of that leg into the ground while tucking the knee into the chest. If you start to feel neck pain, trying to hold your neck up, take a hand behind your head and then let that head just relax in your hand. And then we would finish with 20 to 30 seconds of the double tuck again. So you want to start with the double tuck for 20 to 30 and then take a single tuck on each side for 20 to 30 seconds and then finish it with a double tuck again. While we're laying down here, we're going to do one of my favorites, which is the double spine rotation. So laying flat, feet are together, knees are together, arms are going to go out to the side. Keeping my shoulders down, I'm going to let both of my legs fall together toward one side. You're only going to go as far as you can with your shoulders staying on the ground. So if I go any farther with my knees, my opposite shoulder is going to pop up off the ground. So from that starting position, I go as far as I can, letting them fall and relax. And then I'm going to turn my head the opposite direction. So my knees are going to the right, and my head is looking left. This may be one of the favorite stretches that I have for stretching the low back, as well as the QL that connects from the spine down into the hip bones. 20 to 30 seconds, we'll come back to the top, and we'll switch sides. So my legs fall to the other direction, keeping those shoulders down. Head looks the opposite way. Hold. This one should feel really good on that low back. And then you can repeat this one immediately. So 20 to 30 seconds. Back to center. Switch to the other side. 20 to 30. And then we'll finish out side 2. Alrighty. This will transition right into our hamstring and calf stretch. So again, we were talking earlier about making sure that we keep the back side nice and loose. We're going to do the same with this next stretch. So one leg's going to come up in the air. You're going to pull the toes back towards your nose. Keeping this leg as straight as you can, while pulling those toes, you may immediately feel the back of the calf. If you do a lot of walking and not very much stretching, that calf is going to be tight. Tight calf equals foot pain, and eventually can equal, can equal arch pain and arch issues. So pull those toes back. Once you're in that position, reach behind anywhere you can reach, whether it's down behind your hamstring or up behind the knee, and you're going to pull until you feel that resistance but no pain. We're going to take 20 seconds right here, and then we're going to release the foot, which is going to allow you to pull it in farther. Because without the calf in there, most likely you'll be able to get more range through that hamstring. And then we'll switch legs. So opposite leg straight up in the air, pull your toes back, leg is nice and straight, pull as far as you can, feeling the resistance but no pain. After 20 to 30 seconds, let your foot relax and then pull in a little farther. All right, final stretch, our prone hip flexor or quad stretch. I'm losing my hair. This is the only one we're going to do face down. So we're going to flip over, face down. So earlier we were talking about when we were doing the single leg knee stretch, pulling the knee to the chest, we were talking about the importance of opening up the hip flexors as well. So this one is going to be a quadricep stretch, so the major musculature of the front of the leg, and then we're going to add a little hip flexor to it. So we're going to bend the knee, one knee up in the air, or reach back and grab wherever you can grab. You can stick a finger into your shoe, that works. If you can grab your ankle, that works. If you don't have that kind of range and you can't grab, take a towel or a band and wrap it around the front of your leg or front of your ankle or shin, then roll back over. So now I've got something that I can grip and pull with. So we're going to keep both hip bones pointing down to the floor, and we're going to pull forward or pull up into your body. What you want to feel is a stretch down the front of your quadricep, so down the front of your thigh. We're going to hold for 20 to 30 seconds there. And then we're going to turn it into a hip flexor, so it's going to come higher up. All you have to do is squeeze your glute like you're trying to push your hip bone into the ground. So squeeze that glute, hip bone is pushing down, and you should immediately feel that stretch go from lower in the quad to up a little bit higher. And hold for 20 to 30 seconds. Then we'll repeat on the other side. So we'll take just the quadricep stretch first. My glutes are relaxed. I'm only working on pulling through the front of the leg. 20 to 30 seconds, and then I'm going to squeeze the glute and push down, and immediately that stretch comes up higher. And we're going to hold there. And then to finish off this entire stretch session, we're going to come up from here and push back into a child's pose. So knees about hip width, leave those arms reaching in front and sit back onto those heels. This is a good place if you enjoy yoga to also throw in some cat-cows to finish it out. Just as a little extra mobility and movement through the spinal column and through the hips. Alrighty. Please make sure you try to do these every day or at least 5 days a week. The only way that mobility gets better is that if you practice it daily. So really commit yourself to the next 4 to 6 weeks on hitting these mobility exercises daily, and hopefully you will start to feel a difference in that range of motion and the movements that you can go through without pain. Let me know how it's going and if you need any help or any more exercises.